Hi, everyone. Welcome. Oh, it's always exciting when we get a huge number of people joining the call at once. Welcome, everyone, to the May 2023 DIME Virtual Journal Club. I'd just like to introduce Joanna Serbu, Medical Device Innovation Lead at UCB, Carrie Northcote, Senior Director, Digital Sciences and Translational Imaging at Pfizer, Sylvan Zorman, Director of Digital Health Sciences at Actigraph, Will K. Wang, PhD candidate at Duke University, and I'm Jessie Backer. All right, here we go. So defining digital measurement of scratching during sleep or nocturnal scratch, a review of the literature of this recent publication in the Journal of Medical Internet Research. Okay, so key points that we will cover. I'm going to take the first few slides and then hand over to the real experts in the room. So I'll be setting the stage, and then I'll hand over to Will, who is going to give an overview of the methods, results, and discussion. And then all members of our panel will be involved in the Q&A. Very importantly, we have a really impressive multidisciplinary team involved here. So founding project partners, I'd like to just acknowledge the contributions from AbbVie, Janssen, Novartis, Pfizer, and UCB. Project collaborators, Advancing Innovation in Dermatology, Almirall, GSK, Leo, Lilly, and Sanofi. And expert partners, National Eczema Association, Global Parents for Eczema Research, Duke University, Harvard Business School, Boston University, and Health Outcomes Insights. So as part of this pre-competitive collaboration hosted by DIME, we have a really, as you can see, wide breadth of expertise, all from different stakeholder perspectives. This slide gives a high-level overview of the entire project, and I encourage you to scan that QR code or grab the link and go to the DIME website to learn more about all aspects of this project. But there were elements of patient research, measures terminology and ontology, which you're about to learn a whole lot more about, some tools for supporting the operational components of taking theory into clinical trials, and then, of course, really importantly, resources supporting payer acceptance of these measurements. Okay, so to level set on some terms, appropriately enough, ontology is a set of concepts and categories in a subject area or domain, specifically depicting their properties and the relationships between them. And that will, if you're not familiar, that'll make a whole lot more sense when we jump in. Terminology, of course, is the body of terms, a bit like a glossary, used within a particular technical application. So the names of objects and processes, properties, and functions, but also the organization in terms of how they fit together and how they can be categorized. So taking a little bit of a step back before we jump into the details on why this kind of thing is important to begin with. So anyone who has been following the field in recent years, as I'm sure you all have, has seen the rapid development of digital health technologies in both clinical research and clinical practice. And that is a really good thing. We're seeing a huge amount of development and innovation of these tools, as well as various methods of assessment and looking at quality and fit for purpose. I don't mean to rain on the parade, but there is a flip side to that. And that is that especially when a field is in its early stages and still developing terms, what tends to happen is that there is a lot of development of different types of measurements and definitions that don't necessarily align with each other. So lots of different outcome measures and endpoints that all kind of fall under the same concept of interest. But if everyone is developing their own definitions and measuring things slightly differently, becomes a real challenge for anyone who is thinking about implementing these tools in research or practice. Of course, it makes comparison across studies really challenging. And in some cases, apples and oranges just means that we cannot meaningfully meta-analyze the data. So that's really why a lot of these collaborations focusing on terminology and ontology are so important. So our ultimate goal is to align on what a scratch is, which seems really simple, but as you're about to see, it's not really. So the evidence-based definition of a measurement itself, its properties, and its outcome measures. Aligning on that will provide everyone with a powerful, robust research-based dictionary that can ultimately drive rapid acceptance of novel digital health tech-based measurements in both research and clinical care by patients themselves, clinicians, industry, tech developers, regulators, and payers. And if you think back to that early slide with all the logos, we have a lot of these different stakeholder groups represented within our collaborative team. So with that, I will hand over to Will. Take it away.
Hello, good morning and afternoon to everyone. My name is Will Wang. I'm a fourth-year PhD student in Duke's Biomedical Engineering department. And I'm going to start talking about how we actually performed the literature review. So there are basically two parts to this literature review on Nocturnal Scratch. And the first part is to find definition of scratching in patients with skin inflammation. And the second one is a little bit more targeted literature review of sleep in the context of the period during which the scratching usually occurs that we're interested in. So the scratch certain definition and criteria are listed out here. So we don't want to just find a scratch in general. And there actually are a lot of studies on a scratch definition in mice, because that's where most of the genetic and genetic biomaterial biochemical research comes in for scratch. So we wanted to mostly focus on humans and how the research is done on humans with regards to scratch. We make sure that the title mentions scratch-related topics such as scratch, itch, pruritus, so that they're included in the title, and it's the main focus of the paper before they are included in our review. And obviously, there are multiple layers of checking afterwards to make sure that the publication is relevant and there are relevant information. And we also limited the search period to about 15 years from last year, all the way dating back to the 1990s, where the start of this research began. Next slide, please. So so for the sleep scratch, it's a little bit more different than that. For scratch, it's pretty much comprehensive and a very detailed review. But for scratch, but for sleep, we're mainly focusing on sleep with regard to secondary sleep symptoms such as cramp, pain, and spasm. And we use a specific term for the sleep periods, like sleep opportunity and attempted sleep. And the reason for that is that the definition of sleep is a lot more concrete and a lot more well built in this in the literature. So there's really no point for us to sort of rehash everything. We just need to find out how researchers usually use sleep and define sleep when sleep is used as a secondary time period or measurement when they're focusing on something else. Next slide, please. So this is the pipeline for Scratch. We went through multiple layers of screening, and we searched from the largest medical related and digital health related research literature bases. We did multiple layers of assessing and dropping duplicates, as well as including and excluding literature based on specific criteria. The detailed information is in the paper if you're interested in reading about them. I'm not going to go through them in detail here. And for the sleep and nocturnal, we search mostly in PubMed and Google Scholar to just get like the overarching the overarching viewpoint from the literature. So the results is that for Scratch, we found 29 papers contain a definition of Scratch in detail, and we have a summary of them. And we also found 2 of the found papers have description of both the sleep variables and their definition for nocturnal scratching, which is comparatively very few. And 2 of these papers, 2 of these papers are also very old, and no one has really updated them to try to set a standardized definition of nocturnal scratching. But for sleep, we found 50 of the papers informing sleep ontology, especially for sleep opportunity window and attempted sleep. Next slide, please. The scratch, we summarized the scratch results in. Sorry, is there a question? Oh, okay, no problem. We have time for questions later. So for the scratch search, we summarized these following data fields, which included uh, the basic information of the paper, like author year, the number of study participants, the clinical outcomes, the devices used, which is of interest to a lot of our collaborators, and the scratching definition, terminology, and the scratch detection method. And the reason why that is collected is that during the literature review, we found that scratch sometimes is recorded not just with hands or with videos. They actually have pressure sensors. They use actual machines so that the force and the length can be more easily quantifiable, which is why we started having this scratch detection method collected in the paper from each paper. Next slide, please. So taking a closer look, there are different descriptions of scratching, and there's some examples. Like a very detailed and layman term description is for scratching is an apparent action of rubbing or scratching to any part of the body with a rhythmic movements using hands or fingers and sometimes feet lasting for more than 5 seconds. And of special interest is the last part that is called lasting for 5 seconds, because we discovered that for a lot of papers, this time period is actually very different. Some other descriptions include rhythmic movements. Next, wrist activity, which is too generic in general, and limb motion. Next, like burst of electromyographic activity, which is basically means some sort of muscular activity, movement with frequency, any skin contact movement that reduce itch while not taking into account touching. So itch itself is actually very difficult to measure for a lot of these papers because it's neurological. Like you can actually visibly, objectively see it. So for example, the last description sometimes is not really that helpful when defining when trying to define scratch with a standardized manner. Next slide, please. Oh, yeah. Next slide, please. So the different outcomes of measurements of scratching, which is of specific interest to researchers, include total scratch time, which is most commonly used, amount of acceleration, wrist activity in the 0 to 3 Hz range, and then total scratch records per sleeping time. So that is usually an overall total scratching time when bounded by the time of actually sleeping. And different definitions of on-scratching bout length would include 5 seconds, 3 seconds, 2 seconds, yeah, and 1 second. So basically every paper has a different definition of the scratching bout length that they're counting. So it's very difficult to compare across different research and different devices. Please continue. So when we're trying to form an ontology, so basically have the blueprints or the mind map of what are the things that we need to keep in mind when giving a definition of Nocturnal Scratch. We included the following fields. So all of these fields we believe needs to be filled or discussed before a researcher can propose a definition or try to match a definition. And these are characteristics, for example, the screed frequency, which was in the description of scratching that we discussed before, the scratching outcome, for example, total scratching time, amount of acceleration, scratching tool or body part. So sometimes like your hands, your feet, are they all included? Or like, for example, when you're just scratching, like you're just moving yourself against the sheet to try to alleviate some of the itching feeling, does that count? And next property includes the area scratched. The next property is the duration of the scratching bout and also the method or tool of the recording scratch. So what we realized is that definitions of scratching and related variables differed widely across the entire research spectrum and across multiple years. A unified definition has never been proposed. The definition discerning it from the sensation of itch is often not provided in research studies or during interactions with patients. So for the purpose of creating ontologies, we propose a definition of both itch and scratch. And the term nocturnal is itself exclusionary misnomer, although historically used to describe scratching during the time of sleep. but sometimes actually can happen during the daytime. For example, if someone takes a nap or someone goes through shift work and has to sleep during the day. The nocturnal is not exactly correct. Next slide. So what we want to do with this ontology is to aid unified understanding among scientists and researchers so that it can serve as a roadmap for the development of future standardized measurements of nocturnal scratch. And we provide a rich list of properties available to add to measurements. We believe that some of the properties should be required at all times, for example, the duration of scratching bout, the definition of sleep period, and the measurement modality, because we believe that this strongly affect the performance of the digital measure. And researchers can decide to add more advanced optional properties, such as like the frequency, descriptions, and accelerometry data. Please. Next slide, please. So this is a visualized format of the scratching bout, where if you have the minimum scratching bout duration to be counted towards the total scratch time, which is usually which is the most commonly used clinical outcome, and then what is the pause in between to count two different like continuous bouts as a bout per se. So the total scratch duration is all of the bouts added together during a period of sleep. Please continue. The total sleep opportunity is the bad time off, where people turn lights off to start attempting to go to sleep, and the time that they get up from bed. So I mean, this sounds very simplistic and intuitive, but actually what ended up happening is that a lot of people don't define it. For example, if you get, I don't know. So a lot of the times, some people like there's some confusion about whether you want to add this period where people get up from bed or like they're semi-awake before they actually move away from the bed, or like basically this wake period before they getting up from they wake up, but before they get up from bed, should we actually include that as include it in to define it as the sleep time? And this is the overarching mind map. Oh, sorry, let me delete this. Sorry, I'm trying to erase it. Okay. Okay. So this is the overarching mind map or ontology of a scratch definition. So we define scratch as the behavior and action of rhythmic and repetitive skin contact movement, and to alleviate itch. And itch is defined as an unpleasant cutaneous sensation that could provoke a desire to scratch. This is a little cyclical, but unfortunately, it is very difficult to define itch in a way that's visually and behaviorally observable. So some of the properties we've mentioned before, and we believe that these listed properties here are the most important. And when someone is trying to propose a digital measure, this has to be included for it to be a standardized digital measure that other researchers can then replicate. Next slide, please. And a lot of the other fields that you just saw popping up are other descriptors that we believe that some researchers can propose or can try to define for specific experiments. And the metadata at the bottom would include the scratch measurement modality, surveys, for example, like accelerometry, videography, and acoustic sensors, and some other metadata. Please, next slide, please. The definition of sleep is a little bit more straightforward, where nocturnal, as we said before, is not exactly correct. So people have to be very careful with just referring to scratch as nocturnal when they don't specify what kind of sleep they're referring to. The sleep opportunity or total sleep opportunity is the amount of time that the individual allows themselves to go to bed, or attempted sleep and intended sleep is the time between bedtime and wake time and a person intends to go to sleep. So and this is and the starting time and the end time, and exactly what defines the start and end time of a sleep period, the researchers using is the most fundamental characteristic that we believe a definition of nocturnal scratch must include. Next slide, please. And these are some of the rest of the measurements. The researchers are free, we believe, to define scratch for like different periods of sleep stages and things like that. And the metadata included will be sleep measurement modality, whether it's using wearable devices, PSG, or just through visual inspection, or sleep diaries, for example. Please continue. To sort of conclude, what we want is a digital clinical measure with defined and unified terminology and properties so that it can become a technology agnostic. We can enable the creation of reliable verification and validation procedures, and we facilitate the comparisons of performances among different tools and devices, as well as the measurements between patient subpopulations. And we add valuable information about the patient populations and support pre-competitive collaborations. And enable better communication and sharing of results between stakeholders so that we can make adoption easier for all stakeholders. And specifically in this case, it's about nocturnal scratch and using scratch as an objective measure for skin inflammation. Okay. That's it for me. Thank you.
Wonderful. Thank you very much, Will. That was a fascinating and very detailed presentation. So really appreciate you taking the time to explain all of that. Just give me a moment here. I'm going to just bring up a couple of really general questions, and I'll ask anyone from the panel to please go ahead and jump in. While we're having this discussion, anyone on the line today, please go ahead and start adding your questions into the chat box, and we'll take those as well. Or alternatively, just raise your emoji hand and we'll call on you to contribute. But at a high level, if I can ask any of the panelists, which of the literature findings as you progress through this process were expected? And conversely, were there any surprises that jumped out at you through this process?
I can start. I think throughout the process, it was really interesting to me how itch and scratch were kind of interchangeable across the literature. And when it comes to sleep and nocturnal, I understood how that was going to be complex, but the concept of itch and scratch, people will tell you, yep, totally understand. And I've actually watched people flip them when they told me they understood it, and it was great. And then halfway through the conversation, they switched to one or the other. And we were going through the literature when Will was going through it. It was still interesting to see how it was being misused. And part of it is it's just so common, and it's just one of those that's easily confused. And from a scientific and used within both digital as well as just in the field to bring up new endpoints, et cetera, you really have to clarify those different because they really are. And there's just assumptions that one will equal the other. And I just don't think that's what's proving to be the case. So from the literature perspective, one of the surprising things was just how many times, we started with scratch, and Will said we had to expand to pruritus and itch and continue on because there was just how many different ways it was captured was really interesting. So that was one of the surprises for me. Sylvan?
Yeah, and indeed, as part of the consortium led by DIME, this is something we also observed when we did patient interviews where, as you said, like patient would just mix the two, scratch and itch. I think something that is not surprising here to me is that this work is actually needed. Here with new digital technology, we are bringing new data, new insights, and then it creates new issues on how we talk about it and how we define that. So the things that was kind of surprising, it was the fact that it was not very patient-centric. It seems that many of the literature was done by more technology development research, and that kind of research was missing each component, maybe each perspective, not defining each and properly, and also the fact that there's not more literature, because at the end it's not that many papers on Scratch, where anyone will think, oh, that's the thing that is essential to atopic dermatitis and many other conditions, and actually there's not much work on that. So while patient would easily talk about it, or it would be easy to see how Scratch is a major aspect of the disease, there's not that much literature on studying this. That's something that was surprising to me.
And if I can add to what Gary and Sylvain just said, so what was interesting for me is that, so I was expecting that from this work we'll get a definition of the Scratch, of a nocturnal Scratch, and some information about the components, like what it's the measurement about. But I was surprised to see like how complex is that. And so there is not only the scratch duration or the scratch frequency, but there is more than that. There is the intensity, there is the location, there is the tool. So a lot of things that we do not think about. So my realization here and the takeaway is that a measurement is not as simple as we may think. So that's why this work is very important, because it's really giving a visualization about the measurement. What are the components? What are the factors that can influence the scratch? So there is itch, there is sleep, there is all these things that we need to consider. And also what I think it's very interesting and we can use in our work is that in this publication and the work it's coming, so what we have is the components, for example, the duration or the intensity. And I think it's interesting there is that there is recommendation about what components are must be used, which one are more optional. So I think it can ease the work and deployment in the trials.
Well, I 100% agree. And actually all three of you touched on something really interesting there. And that is that, because the concept of Scratch on the surface seems so simple, that any person on the street would give you a definition, which is often not the case in medicine, that actually there is a downside to that, which is that the terms are not very well defined and that you do need to, undertake work like you have all done to actually put some parameters around it. So thinking about the technology, I'm going to just take this question from Candice in the audience. Your literature review spanned a long time frame, which is excellent. Can you, anyone again on the panel, maybe give us some insight into the types of technology being used over that long time frame? Did you see differences going back to the 90s versus more recently? Can you give us some examples of what kind of tools are out there?
I can start again. It's really interesting because you start with, your scratch is observed just by the clinician looking at the exudations. So when I came to tools, then you start going into really videography when you start as a possibility. But it's even interesting there because it's more complex than just videography, because videography gets you a picture, but then that requires someone to watch the video, annotate the video, and depending on the type of video, and you see this progress over time, the different types of videography. So first it's just, basic videography. Then you have, the night vision and the different type there. And now, I know in some of our work we use thermal. And then, you're seeing all the advances. So as technology is advancing, you're seeing more and more fancier ways to do it. And now when we come to digital health technologies, we're looking at wrist sensors, you're looking at armbands, you're looking at things that you wear on your hand and stickers. You're seeing the room sensors versus the others. So you're seeing as technology is gaining, we're getting more and more precise in what we're doing. We're starting to be able to quantify that more. And I think that also struck home to me the importance of this work that Will did and others is, as we're improving, we're needing to refine those definitions. So when one scientist looks at it this way, another looks at it another, it's, one uses maybe videography and one uses actigraphy or accelerometry, wrist worn versus hand worn. You may see different values. It may not be that they're much different in accuracy, etc. It's just how it was measured or what was measured and the importance behind that. So the technology has been continually advancing, and I think it will continue to do so, which is great. And I actually think because the technology has been advancing, we're learning more about scratching and the respect of, when we started working in this, was like a mild scratch is just your fingers, and then moderate is your arm, and then your whole arm gets into it for a severe. And I laughed. I argued one time. I said, so I can really do a lot of damage just with my fingers, but that's still considered mild. So I think what we're going to start to see evolve is even more and more depth into the actions that occur and how we can measure it. And no, I'm not saying we're doing it, but I think you're going to see more and more precision come into this, and better measurements. And I'll be quiet, panelists, others.
And I think with the expansion of technology and the different way we can look at the same thing, then it makes even more important that we all use the same definition, because otherwise, if we don't standardize like the definition of a scratch event that should be 3 seconds or 1 second, or if we don't even share this critical information in the publication, then there will be no way, like we will have to repeat again and again the same studies, because there will be no way to reuse the data from one study to another, or to compare like, oh, but they use a different technology for this research, so we know what will be the bias, or they are not looking at exactly at the same thing. And if we don't have the proper concepts to actually nail down how things are different, what's the impact of using different technology, then it will be very hard to actually move forward with this field.
And what I just wanted to add, maybe to what Kerry said, is that there is indeed a few type of technologies, and currently, so the big one that can be used for patients like directly. So there are wristbands, there are environmental sensor, or all like the type of patches potentially. And what I think, so maybe another type of will come, but what I think it's interesting to have those diversification is that people can choose, patient can choose the one which is more fit for them, for their daily life, for their purpose. Sponsors, so pharma companies can choose which one is the best adapted for their study objectives. So have this choice is the best, I think. So that's why if the technology evolution is going in this sense, that will be good.
Yeah, and we're talking about the technology, but there's the patient. Like it could be that in the pediatric population, like we won't require the same sensor than in another population, and I think patient centricity is again something critical.
And even going back to, I'm going to follow up on Sylvan's comment too. You can imagine in a paper, I can say, well, we're more accurate. And then you actually get into those weeds of how they measured it. And if I described a scratch event to be a 15-second long event, and I'm just throwing out a long number, I could make my accuracy look great. But is it physiologically relevant either? Because I mean, I joke, I sat in a room one time, and they're like, well, this is the perfect number from a data scientific, it's going to give us the great accuracy. I said, but is it really relevant too? Because, you got to start thinking about, 15 seconds, that's a long time to be scratching. But yeah, it might statistically give you a phenomenal value. But then also, if you're trying to compare paper A and paper B, a lot of people just go in and go, well, this one's more accurate, so we're going to go this way. And they don't get into the details, or those details aren't shared. It's just like, well, we're just, look at our accuracy, look at this. And until you start to understand some of those details, which this paper is starting to argue is, hey, you have to give the details with the measurements and the information that are preceded. And I think that's important as well. Sorry, there you go.
Okay, well, there's a lot to unpack in those responses, but early on, I think it's probably fair to say that, there's, as you just described, all of you, there's a lot of different technologies out there for measuring scratch. And of course, it has evolved over time. And there will probably, in fact, no, there will always be differences in technology. But if we also are using different definitions and different tools, then we're never going to align. So if we can align on the definition, then the tools can all be analytically validated, with a common reference.
Got it.
All right, a question from the audience from Jose Sanchez. How do you define sleep opportunity in situations where people may not turn off the lights to sleep? So examples being those living close to the poles, where there in the summertime there is, you know, an unusually long light period. And I'm actually going to like add a little bit to that question of my own perspective or confusion, and that is that a lot of light sensors, if they are on the tool itself, which might be on the wrist or somehow on the body, if that's then covered up with a blanket, do you have any recommendations around all this?
It's a tough one, and probably it's like a multi-million-dollar questions. Indeed, like the more we progress, the more challenges we have around definitions, and I don't think as of today this is something that has been absolutely well defined. It's a work in progress.
It's so hard because it started out so easy. We're just gonna measure scratch when you sleep, but then you're like, okay, well, what do you mean by sleep? And what do you do with people that nap all day or that nap off and on and only do it for so many hours? And that is a great example. What about the poles where the light, you know, you're still sleeping, but how do you define that? And when you do, and also I think it's, I have to agree. So I think we're still kind of working on that. I think we're just starting to put some guardrails around it. And then we have to think about the technology and the disease as well. So one of the things that's been interesting is we're just now starting to capture scratch. So when do you, it's always hypothesized that you do it when you sleep, but then you actually, and I know we have it in our paper and work that we've done, the first question is, so when do you actually scratch? You know, and so that was the first look we actually did, was we just said, all right, when do you scratch? Is it actually when you're asleep, or do you start scratching beforehand, or what all occurs? And so it gets complicated really quickly. And again, the term, I think the whole project team, we struggled in this space a lot too, because you wanted to define when you were measuring. So I think that's where the total sleep opportunity came about. But then it boiled down to what was relevant for the disease. And then, so if I just said scratching during sleep, do I include all those nap periods? Do I include when I close my eyes for 5 minutes? What about this? What about that? And every type of scenario became complicated. And I think we even acknowledge in the discussion with this, and Will, you do too, it's tough. It was just a tough one to do. So I wish I had a great answer for you. I think the whole concept of is that's where understanding your tool is really important. What are you considering? Are you using a light sensor? Are you using movement? Are you using a combination? Are you using temperature? Are you using heart rate? That's where understanding the variables that how you're detecting that rest period or sleep opportunity happen. And then if you have set rules for your measurement, making sure you share those within the literature again, so you're allowing good scientific practices, so I can compare, you know, what they did versus here. And I think we're going to see that continue to evolve as this field continues to evolve, you know, and we're going to start to look more into the different specifics as the technology improves.
And just to echo what Kerry just said, I think that's one of the challenges with the digital health technology. You can get like 30, 100, 500 data points per second, and you can get lost into maybe so much information. At some level, also, we should take a pragmatic approach, saying, yeah, we might be missing that and that, but at the end, like the goal is not to have the perfect measurement. This is work in progress. This will be ongoing for a long time, and there will be new technology bringing new issues. And at some point, we also need to be pragmatic, saying this is not the perfect measure. There will be some bias here and there, but like people have been using tools like patient-reported outcomes or other things that are not also perfect. And so I don't think we should just like put our standard there.
Let's put the bar up here. Yeah, let's start real.
Yeah, and never develop anything for and make anything available for the patient, because it's not up to like the best standard that we could achieve. Because at the end, right now, drug developer sponsor, they are relying on tools that are not perfect, and so we should move the needle, but like one step at a time. We should not wait for everything to be perfect to actually say, okay, we've done everything, because that will never happen. And that's where also I think I'll just add one point, like the consortium approach, putting everyone around the table to at least address the MVP, the minimal viable product that will cover everybody's need in a way that is relatively pragmatic. That's probably the way to approach that. Sorry.
Yeah, thank you so much. So I absolutely agree with both of the panelists' answer just now. But just wanted to add something. So so we're getting into a space when we're talking about like people living in very specific conditions and that are very different from the normal population. So we're getting into like caveats, we're getting into edge cases. And obviously, so most of the time when we want to push out something or deploy something, we may forget that these populations exist. But eventually, though, like as the research field continuously grow and develop, we can add these caveats in, like with qualifiers about like whether it gets from a more clear-cut definition into more like I'll just approximate or a proxy. So this does happen, and when most scientists do research, the population is a lot of the times a little bit more controlled. So like when the algorithm or the digital measure is being validated in the beginning, a lot of the times our population will be a little bit homogeneous, and we will miss potentially these caveats. But the future algorithm development and verification and validation should be very mindful that we want our product to be generalizable and be able to at least help people in these kind of edge cases. So that's just sort of like a piece of thought.
I challenge whoever asked the question. I think that might actually really be a cool study just to understand the differences between the two. So if you chose when they slept someone in Sweden or the various polls compared to someone that had light, that's a great scientific question, and you can actually ask that using the tools now that we couldn't ask before. So are there impacts due to the light variation on both the sleep as well as the scratch patterns that occur in these patients, because they still get various dermatological conditions. So it's not only using the tool, but can use the tool as designed to see if there are differences that you do need to compensate for.
Yeah, that's often the way, right? You answer one set of questions and about 100 more just kind of come out of the woodwork, and that's how we keep going. So my next question is a little bit more high level. You've developed a really detailed and very helpful, set of terms and an ontology linking them all. Can you provide some recommendations on how researchers or sponsors or any other parties can take that terminology and actually apply it in their clinical trials? Or in fact, I'm actually going to expand that question and say even tech developers, now that this ontology exists and is out there, how do we move from theory to practice?
I'll speak from the scientist point of view. For us to continue to advance in this space, we have to have the same terms and the same words. And as I think Will went through the literature and others have gone through, there just wasn't an alignment. So I think we put the stake in the ground and said, okay, for us to get any farther, we have to all agree with what we're going to call it. And we know it's going to change, it's going to evolve, but let's start. So that way, as we build the scientific field, and I apologize, this room likes to turn its lights off. As we continue down this space, it sets that in so we can start to do the comparisons. And also, we kind of said, let's go back to good scientific practices. Let's talk about how we're measuring it, what the distance orders, et cetera, so we can continue to build and improve. Sometimes we get a little lazy in the science field and we measured sleep and scratch or itch, but no, we meant this, and all of that. And we're saying, hey, you not only have to give us, let's use the right word, the right term, let's give the specifics on how it was measured. If we're using a digital tool, what device did you use? What was the software? How did you collect it, et cetera, so we can continue to build. And I think that's also important when we talk to patients and we talk to healthcare providers in clinical trials. I spend a lot of time, I know, explaining the differences. Well, we already measure itch. Why do I need to measure scratch? They should be the same. And I'm like, but they're not. Well, why is that? I said, well, we have the tools. Let's start to figure that out. And both are important to the disease. So let's continue to do that. So it's really sparking the conversations and getting people to reset things that have just kind of been trained. And I always joke, we're gonna do it one person at a time. And now we've got 30 plus more people hopefully championing the cause in really using the right language moving forward.
Well, thank you, Carrie, for that answer, and also for giving us a live demo on light sensors and how they that was excellent timing.
I'm just waving to everybody.
So Jessie, if I can as well to add something here. So to bring more confidence to people, to bring this in practically, I think what's important here, of course, to start from the same sources. So this publication is a good starting point. So there is a lot of summary of the important literature resources, of some good recommendation. So being already familiarized with this information, that is not so complementary to this article. There is a lot of resources on the DIME webpage on Nocturnal Scratch, which can, of course, as well bring a bit of more information about why Nocturnal Scratch, why is this important. So really build this knowledge information, which will bring confidence to the people who are driving this initiative, but also to have ground to discuss with the clinical teams and so on. So this is the first point. And second thing, which I think that can bring a bit more confidence as well, is for us, for sponsors or for tech companies who are doing tests, studies on the Nocturnal Scratch, to publish more, to share, to make the results visible. So like that, well, everybody will start to have more confidence, to more courage to build this, and that this is how everybody doing something will know more and will have like a better advancement in the technology or knowledge about Nocturnal Scratch. But yeah, more publication, more making the results visible.
That was one of the cool parts about this consortium as a whole, is it wasn't just pharma. There were advocacy groups involved. There were academics involved in some of this discussion. So it wasn't just one company saying, all right, let's do this. It was at least some companies, as well as the community as a whole, coming together to kind of discuss and bring that forward. I thought that was really a cool advantage of this.
Absolutely. And I know I gave her a shout out at the beginning here, but Lucy Sesnikova from DIME did a really great job of bringing together all these different stakeholders and really blazing the trail for our digital measures portfolio here at DIME. And of course, all of that relies on all the contributions that come from our partners and collaborators. So I have a quick question, and it's going to go beyond ontology and terminology, so I apologize for that in advance. I hope I'm not putting you on the spot too much. We talk a lot about validation, and specifically analytical validation. Your project looked at sleep and defining, for example, the sleep opportunity time, and also, of course, Scratch. Now, in terms of a reference standard, sometimes referred to as a quote-unquote gold standard, polysomnography has been around for a long time as a reference standard in sleep, and there are published guidelines for sleep staging scoring and that kind of thing. On the scratching side, can anyone comment on what it's like to be developing and assessing these tools when the reference standard, so what I mean by that is the assessment of scratching from, say, a video, is also being developed at the same time?
Yeah, so in this space, we're building the plane while we're flying. That's what we're doing every day. But Carrie will have much more to say about that. But I think here, that's also where this work is actually very critical, because it's not only about so gold standard would be infrared camera recording, but then it's not only about this data set. You also need to include training of the raters, like all the definition and all of that. And how many raters do you need? And then if two of them agree and one doesn't agree, like, what do you do? And that's where there will never be any absolute standard on all of that, because technology will evolve, we learn new things, and things will go on for a long time. Here, what's critical is, again, the collaboration, being transparent, applying the best standard on sharing how it has been done, how people have been trained, and all of that. But yeah, it's still something that we're working on. So, but Kerry, I'm sure you have much more to share.
No, it's a great point. I joke that gold standards really aren't gold, and maybe fool's gold. And even polysomnography has issues too, because now you're taking someone and you're sticking a whole bunch of stuff on them and then telling them, oh, sleep naturally. It's all good. I think the key is just to use good scientific practices. You can't just take, when it comes to even the video annotation with Scratch, you have to have multiple raters. You have to have arborators. You have to be able to go down. I know when we did our work, I joked, I walked in and there would be like 10 people hovering over a camera and going millisecond by millisecond, back and forth to try and figure out when things start and when things end. And I think it's making sure you follow good scientific practices, understanding that it still may not be perfect, going back to your point earlier, Sylvan, but it's a lot better than it was. And I think as we continue to improve, you're going to continue to get better. And some of the digital technologies are better than what we're currently using. So that's the tricky part. And then and it's just like, well, you need to compare to a PRO, or you need to compare to X. And I said, but that is flawed. So, you know, you're telling me that yours is perfect, but mine's not. But yet mine probably is a better way to look at it. So I think there's always going to be a compromise in that space. But again, I would just want to make sure everyone, you just got to have that high scientific integrity. You got to make sure that you do your due diligence, that, you know, and also be cognizant of the flaws that come into a space. Because even the video annotation, there's a lot of data out there and that you visually can't see the exact second that it starts. So you're always going to be off slightly because your digital measure most likely will catch it, whereas your eye may not. So you might not look like you have the accuracy that you actually do. So I think you're going to have a little bit of a give and take. But I guess I challenge all scientists to make sure you kind of set that bar for yourself, that, you know, make sure you have more than one person looking at it, make sure you do the proper replications and that type of stuff. And that's what we're taught as scientists.
That is a beautiful way to wrap up our conversation. I do have a couple of slides to share, but before I do that, or actually while I'm fussing about doing that, any other kind of final comments from the panelists?
I'll say thank you to this whole team, the consortium that came together to do it, Dime for putting this up, Will for all the hard work you did on this. It was phenomenal. And I just think it's really awesome that we're kind of saying, hey, we've got to align on language. And that's the first step. And now let's work on the science. Let's build it up and it's going to get better. So thank you all. And thanks for those that joined.
Yeah, thank you. And then maybe one comment from Actigraph. So we currently putting together and planning a launch of a working group to develop and validate this technology and put it on the market through Actigraph. So if anyone is interested, please reach out to me.
And just a final comment. What I would like to say is that the publication, it's one of the piece of the Dime collaboration work. It's a very interesting one. It's a very important one, which I think will be one of the causes why I hope the technology will evolve. Our understanding of the Nocturnal Scratch will be better, and will encourage people as well to deploy and use this measurement more and more to better understand the disease and the patients.
Joanna, thank you so much for bringing that up. This was one component of a large project with a ton of work. So we will distribute the link to the page. So please do check out all those other resources. Congratulations on the publication. Will, thank you so much for the detailed presentation. And to Will, Carrie, Joanna, and Sylvan, thank you. I will just bring up a couple more things. Eventually. Okay, fantastic. Next journal club is June 13th at 11 a.m. Eastern. I'm going to be moderating that one as well, but the star of the show, Manuel Spitzschan, will be joining us to discuss a recent publication that he led, how V3, so the V3 framework, might be applied to wearable dosimeters and light loggers. So join us for that one. Following along on the heels of that, we have on June 27th, a virtual event led by the individuals. I don't have time to name everyone, but Candace from the DIME team will be moderating this one, Striding Past the 6-Minute Walk Test. That's a great title. Complementing physical activity assessment with a consensus set of digital clinical measures. So there's plenty to tune in on coming up in June. Thank you all very much. Stay tuned for more info from DIME.